Hi, everyone. How are you doing? My name is Wendy Myers of MyersDetox.com. Thank you so much for joining me for this Myers Detox Protocol support webinar. Sorry, it's been a while since we've done one of these. I just have been really kind of had a lot going on and things have been a little bit crazy. And we changed the name of my website from liveto110.com to MyersDetox.com. And that just took a lot of work. It was really surprising how much work that was. So I apologize for not doing these and providing this service for you guys. But today I wanted to talk a bit about how to detox your thyroid. And this is something that, a lot of people coming to do the Myers Detox Protocol have thyroid issues going on and are very concerned about metals in their thyroid and want help with and answers in healing their thyroid. So today our webinar is going to be about how to detox and support your thyroid, the top supplements to detox your thyroid, thyroid medication versus glandulars, and best approaches for Hashimoto's, so how to resolve Hashimoto's. And I want to talk a little bit about, and we're going to be answering questions also, so anytime you have any questions whatsoever, please leave a message in the chat box and I will answer those live on the air. And I'm going to just see how many people are in the room right now and chat. That's what I wanted to see. Okay, so don't be shy. Start chatting with me. And so I want to talk a little bit about why thyroid disease is so common today. Thyroid problems are epidemic around the world, especially in the Western world, for a number of reasons. So the number one is stress. Stress can cause many cases of thyroid imbalance of many different types, and they can be physical stress, emotional stress, financial stress, or any type of stress. It just weakens the thyroid gland. And there's also a lot of iodine antagonists in the environment. So iodine is really important because your thyroid hormones are made of iodine. And if you don't get enough in your diet, or you have toxins that are blocking iodine uptake in the thyroid, you're going to have trouble making thyroid hormones. And the water and food supply is loaded with halogens, which are elements that replace iodine in the thyroid gland. So examples of halogens include fluoride, chloride, and bromines. And these elements compete with iodine for absorption and utilization in our bodies. And when they replace iodine, the thyroid gland simply stops working properly. And so fluoride is found in the water. It's found in your shower water. Even if you're drinking filtered water, chlorine is found in pools and in drinking and in water as well that you're showering in or drinking if you're not drinking filtered water. And bromines are used in jacuzzis, and they're also used as dose softeners. So if you're eating a lot of different breads, Subway sandwiches, things like that, you're getting a helping of bromines. Mercury toxicity is probably the biggest assault on our thyroids. Mercury antagonizes or opposes the action of nutrients required by our thyroid, including zinc, manganese, and selenium. And unfortunately, mercury toxicity is almost universal today. And mercury gets into our bodies due to it being in the air from coal burning. That the mercury in the air settles in our fish supply, and mercury is in all fish, except it's in very tiny amounts in the small fish like sardines and anchovies, which are good to eat. But if you're eating any fish larger than that, even salmon, you're probably getting a decent dose of mercury with fish consumption. Doesn't mean you don't eat fish. You just need to take precautions in detoxing mercury from your body. And then there's mercury in dental fillings, huge problem in mercury amalgam fillings. And these don't show on a hair mineral analysis. You don't see the mercury from fillings on a hair mineral analysis. You'll identify that in the urine metals test. But most of us, that are in our 30s and 40s and upwards have had mercury fillings. Those need to be removed because that mercury is getting into your thyroid. And the reason that mercury is a problem is it just inhibits the thyroid function in a lot of different ways. And, but I'll get into that in a second. Also, nutrient deficiencies inhibit thyroid function. There's a lot of mineral deficiencies that we suffer from, including zinc, selenium, and manganese and iodine. Manganese is chelated by glyphosate, which is a Roundup-ready pesticide made by lovely Monsanto Corporation. And manganese is needed for, for the thyroid function in many different ways, thyroid hormone conversion. And I find just almost every client that I test is deficient in manganese. And that is because glyphosate chelates manganese from the body. This is supported in studies. This is shown in the research. And if you don't have manganese, you're going to have trouble with your thyroid. So mineral replacement's really, really important. But metal toxicities interfere in your thyroid functioning in different ways. So I'm going to talk about some of the metals that interfere in thyroid function and why, and also how we're going to detox the thyroid. So many toxic metals like mercury, lead, cadmium, and nickel reduce thyroid function in a lot of different ways. So number one is by enzyme inhibition. Enzymes involve the production of thyroglobulin, which is the storage form of thyroid hormone. Number two, metals interfere in amino acid absorption. So toxic metals, which I talk a lot about, like arsenic, aluminum, tin, and thallium, and cesium, negatively impact the absorption of amino acids like tyrosine in the gut. And tyrosine is required for the manufacture of thyroglobulin. So if you have low tyrosine, you're going to have low thyroglobulin, and you'll have reduced ability to make thyroid hormones like T4 and T3. And if you take proton pump inhibitors, you could be starving your thyroid of tyrosine. So those are bad. We don't want to be taking these acid reducing supplements like Tums or Prilosec or the like. I know those are necessary for some people, but if you're taking those on a regular basis, you're going to be causing thyroid dysfunction. Number three, iodine uptake in the thyroid requires energy. And so any metals that inhibit energy production, like arsenic, aluminum, tin, thallium, and cesium, are going to inhibit thyroid function as well. And so the uptake of iodine in the thyroid is ATP or energy dependent. And if any metals interfere in energy production, they can prevent production of thyroid hormones by reducing iodine uptake in the thyroid. And so that's why I talk a lot about how to detox metals that cause fatigue. And so there's some supplements that are great for that. So Pectosol C is a great supplement to detox metals that cause fatigue. Biosil is another supplement. Of course, I don't have it here. Biosil is another great supplement to bind on to metals that cause fatigue. And so the Biosil and the Pectosol C together are great products to detox the body of metals that interfere in ATP or energy production, which in turn affects thyroid function. So specifically about mercury. So mercury interferes in the thyroid on 4 different levels. So it's called tertiary hypothyroidism or secondary hypothyroidism. So number one, mercury deposits in the thyroid. And so mercury will build up in that gland, and it also will build up in the pituitary gland. It'll build up in the hypothalamus. And so when it gets built up in the hypothalamus, the TSH manufacture is inhibited. It also interferes in TRH, which is thyrotropin releasing hormone, which is manufactured in the hypothalamus. And basically TSH is inhibited and less can be produced. And then mercury interferes in the signaling in the cells themselves by interfering in that delicate feedback loop that converts T4 to T3, and then the signaling communicating back to the hypothalamus. And number 4, mercury interferes in the conversion in the blood of T4 to free T3 in the blood. And mercury poisons different enzymes that convert T4 to T3 in blood circulation. So mercury really throws a wrench into your thyroid functioning. So that's why it's so important to detox mercury. And that's one of our main focuses on the Mai Detox Protocol detox program, is to remove that mercury and slowly but surely start removing it from your glands and from your tissues. And then slowly over time, that will improve your thyroid functioning and your energy and your metabolism and your brain function as a result. And so then lead also gets in the hypothalamus, and that interferes in TSH and enzyme inhibition as well. And there's also some chemicals like halogens that I talked about before, fluoride, for instance, substitutes for iodine. So fluoride blocks sodium iodine symporters that transport iodine into the thyroid. And in the presence of thyroid, you get these fluoride ions substituted for iodine. And fluoride then gets incorporated into the thyroglobulin, the storage form of thyroid hormone. And this ultimately reduces the amount of T3 and T4 that can be manufactured. And the same thing happens with bromine and synthetic chlorine products like perchlorate that's used in dry cleaning clothes. That's why you want to go to a natural dry cleaners if you're dry cleaning your clothes. You don't want that perchlorate in the dry cleaning product sitting in your house, in your closet, off gassing all this perchlorate, because then it interferes in thyroid function. And so the perchlorate and other halogens replace iodine and reduce the production of thyroid hormones. And so I want to talk a little bit about the top supplements to detox your thyroid. And so, we want to detox mercury and other chemicals from our body to improve thyroid function. That's the ultimate goal. But you don't want to think about just focusing on the thyroid. It's a systemic problem. So all these metals that interfere in thyroid production, the halogens, the mercury, the lead, the cadmium, the nickel, the other metals, these are stored in the body in various places in the tissues. So you really have to do a systemic detox, like the Mai Detox Protocol. But the effect of that is to help to improve thyroid function. So the top supplements to detox your thyroid are iodine. So there's a great iodine product that I use. I use a couple. One is Detoxidine by Global Healing Center. It has a couple different forms of iodine in it. But also Liposomal Iodine by Venco is fantastic. There'll be links to that down below in the description. And so Liposomal Iodine is great. It's kind of a newer product. It doesn't matter what you supplement with, it only matters what you absorb. And so if you take a liposomal product, you're going to have much higher absorption rate and uptake and utilization of that supplement. So it's much better to take a liposomal form of any product if you're able to. And so iodine is very needed. Most people are deficient in iodine. A lot of people don't eat fish, or they don't eat enough fish, or they don't eat any seaweed products or any foods from the ocean. And so where are you getting your iodine? A lot of people are eating regular salt that is fortified with iodine. However, you're not getting enough. You're not getting nearly enough in the regular salt. And I do not recommend at all eating regular salt, the table salt, the Morton salt, the salts that you find in restaurants or that are in fast foods or things like that. That salt is very, very toxic to your body. You need to be eating sea salt. So sea salt has about 80 different minerals in it. It matches our body chemistry perfectly. We're desperately starving and deficient in these minerals. And so now they're making sea salts that are fortified with iodine that you can take, but even then, it's not enough. I did a great podcast with Dr. Nico Antonio, and we talked about the salt fix. That's a fantastic podcast, the Live to 110 podcast. If you want to search for the salt fix on MaiDetox.com, we talk in depth about salt and iodine. And so you don't want to be taking salt, regular table salt, just because it has iodine in it. You have to, no matter what, supplement with iodine. And I recommend starting with about 300 micrograms per day, and then even working your way up all the way to 5,000 micrograms per day. Some people need that. That's the amount of the Japanese eat every day in their diet. And everyone's a little bit different in the amount they're going to need, but you need to start slowly, because you have to start slow, because iodine can rev up your thyroid function and can give you kind of a increased body temperature, heart palpitations, make you feel kind of like anxious, can cause insomnia. If those things are happening to you following starting iodine or taking too large a dose of iodine, then you need to pull it back and just take a smaller dose. That's why I like liquid iodines. I prefer those because then you can control the dose a lot better. Many times people are taking a pill, but like Lugol's or what have you, and they can be getting way too much. Those are usually like 12 milligram pills or microgram pills rather, and it can be way too much for some people. So I recommend doing the liquid so you can titrate your dosage. The next product I really like is Coriander Seed Oil. This is a product by Perfect Press. The company used to be called Panacea. But we have that in the Myers Detox store, store.myersdetox.com, to get any of these products that I'm talking about. And the coriander seed oil is great. It's the seed of the cilantro plant. And the cilantro plant is well known for removing mercury from the brain, removing mercury from the body. And so it's, it's not a super, super strong chelator. A chelator grabs onto metals like mercury and removes them from the body. But it does work, and it's very, very safe. And so I love the coriander seed oil. And it's this company here, Perfect Press. This is a black cumin seed oil, but it's the same company. You just get the coriander seed oil. I just don't happen to have it here. And so then the next one is Pectosol C. So Pectosol C is a binder. So you can see that here. It is modified citrus pectin. And this is a product that absorbs all different types of metals and chemicals in the body. And it's really is an amazing product because it will absorb all the halogens, it will absorb mercury, it absorbs so many different types of metals. And so I'll list off all the metals and chemicals that it will detox, that it's shown in research to detox. And so it will get rid of aluminum, antimony, arsenic, barium, bismuth, cadmium, cesium, lead, mercury, nickel, platinum, thallium, tin, and titanium. So that's a pretty impressive list. Not only that, but it can absorb all different kinds of chemicals. So when you're doing any type of detox or taking any kind of detox supplement, you have to be taking a binder. And so this is a modified citrus pectin. It's made from a kernel. It's made from different, fruits. And so not everyone tolerates it. Some people have sensitivities to it, or they'll have GI issues for various reasons. If you have SIBO, small intestinal bowel overgrowth, or bacterial overgrowth rather, then you're going to have, it's going to be contraindicated for you because it's a soluble fiber. It can feed the bacteria in your gut, which is good if you have healthy gut bacteria. But because it feeds your gut bacteria and helps them to proliferate, but bad for you if you have an overgrowth of the good gut bacteria that's found in SIBO, the small intestinal bacterial overgrowth. And so you need to take care of that first before you start supplementing with Pectosol C. And so if you have any kind of reaction to it, you can take other types of binders on your detox. You can take charcoal, you can take, there's another product I really like. I'll grab it here. This is a binder I take occasionally. It's called Parasite Detox by Kiwi's Corner. And it's got diatomaceous earth, French green, Montmorillonite clay, and activated hardwood charcoal. So it's a really nice binder as well if you need an alternative to the Pectosol C. And so the next product is Lipoic Acid. And so I recommend my clients take a fat-soluble Lipoic Acid. There's all different kinds of lipoic acid on the market. There's alpha lipoic acid, there's R-lipoic acid, and those are water soluble. So they're not as effective as fat soluble lipoic acid. The only product I recommend is super lipoic acid by Life Extension. That's one of the only fat soluble lipoic acid on the market. And so that's my preferred product. And you can find that in the Myers Detox store. And the fat soluble lipoic acid is great. That is going to get all different types of metal, including mercury. It also detoxes aluminum, cadmium, lead, mercury, manganese, and tin. And so that gets a lot more metals than just the water-soluble lipoic acid, like alpha or R-lipoic acid, which only gets cadmium, copper, lead, and mercury. So it's a lot more effective, and because it's fat soluble, it actually gets into your brain and pulls out mercury and other metals that I just listed. And so the next product that I recommend to detox your thyroid is selenium. Selenium is needed to make glutathione. It is needed to detox mercury. It's needed to make thyroid hormones. Almost everyone is deficient in selenium. I had tried a lot of different seleniums over the years, working with thousands of clients, and I really prefer the S-E-methylselenocysteine. And so that's found by Life Extension. That's a very specific form of selenium that I have found is the best form that raises people's levels. I've been very frustrated working with other types of selenium, and they just don't raise people's levels. So I prefer the Life Extension brand. And then the next product is glutathione and or NAC, N-acetylcysteine. And so glutathione is great, and as well as NAC, which is a precursor that makes glutathione, because glutathione will detox metals and other toxins that interfere in thyroid function. But I'm more privy now. I'm more prone to giving clients NAC and just giving them the building blocks to make glutathione, and then recommending people do coffee enemas, because coffee enemas will also increase glutathione production naturally. And so NAC is a great one. So NAC, N-acetylcysteine, will help to detox metals, including, let me find my little notes here, aluminum, arsenic, lead, mercury, and platinum. So that will get a nice helping of metals there as well. So those are my top picks to detox the thyroid and the body. And so I want to talk a little bit about thyroid medication versus glandulars. So obviously, thyroid dysfunction is very, very common. It's one of the things that a conventional doctor would typically look for and test for. And thyroid medication is one of the #1 medications prescribed to people. And people will be given usually only a choice of synthetic thyroid medication like Synthroid. If it's a really good doctor, you'll usually be recommended a natural thyroid replacement like Nature Throid or Armor Throid or West Throid. Nature Throid is probably the most common one. And those are a lot more superior because Synthroid is like synthetic T4, and then many people can't convert the T4 to T3, or they'll be given synthetic T3 if the Synthroid doesn't work, they'll be given both. But with the natural thyroid hormone, it's just a more natural form of it, and you're also getting T2 and T1. You're getting other hormones in that. You're also getting nutrients in the natural thyroid hormone replacement. So it's just far superior. I think it works a lot better. And then the other option is glandulars. Glandulars. My favorite product line for glandulars is this Professional Health Products. And this is what I recommend, and this is what I take myself. It's called EcoThyro. I don't know why you can't see it. It's not coming up very well. So it's EcoThyro 125. There you go. And so that's a really good product to take. Take 1, maybe 2 per day. It's pretty strong. And I think that 1 capsule of this is equivalent to about maybe 50 to 60 milligrams of thyroid hormone. So that's a lot. I mean, a lot of people take 32 milligrams of thyroid hormone to start. And if that's not enough, their doctor will just keep increasing it. But the problem with thyroid hormones is that hormone replacement doesn't do anything to improve the conversion of T4 to T3. A lot of metals, like I said, mercury can interfere in that conversion process. And the hormone replacement does nothing to assist the passage of thyroid hormone through the cell membrane. If you have a really high calcium levels in your tissues, that we can see on a hair mineral analysis, that calcium will block receptor sites on your cell membrane and prevent the thyroid hormone from getting into your cells. So that's why a lot of people are given thyroid medication and they don't feel any better, their symptoms don't improve, because that thyroid hormone just isn't getting into the cell membrane for various reasons. And thyroid hormone replacement does not assist in the absorption of T3 into the mitochondria. It does nothing to assist the normal production of ATP in the mitochondria, which requires many nutrients and also requires detoxing certain metals that interfere in energy production, like the arsenic, aluminum, tin, thallium, and cesium. And it also, the thyroid hormone replacement does nothing to assist the body to burn or utilize ATP, convert it to ADP, and then recycle it back to ATP, which is a very important cycle in the body. And so the hormone replacement completely mixes up the delicate feedback system that normally regulates pituitary TSH production and thyroid hormone synthesis and all the other steps in this complex process. And that's why it's typically better to take glandulars, as they're more natural, as opposed to taking thyroid replacement hormone. But, you know, it can be, for some people, it can be difficult to kind of regulate that on their own. Like for the glandulars, like one capsule, the glandular can be too strong. So they have to open the capsule and take a little bit out. Some people only need a little bit. Some people need 2 capsules. It can be a little bit more tricky to find out the dosage that you need that works for you. Some people are more comfortable working with their doctors with that. So you have to do what works for you. My recommendation typically is for people to take glandulars as opposed to the thyroid hormone. But the thyroid hormone, be it synthetic or natural, is much easier to regulate because it has that exact dosage of the hormone. So you know exactly what you're getting. In glandulars, it can vary from batch to batch. So it can be a little bit more challenging for people. And I want to talk a little bit about Hashimoto's. So Hashimoto's is where the immune system is attacking the thyroid gland and destroying thyroid tissue. And so this can be present another challenge. And this happens for a number of reasons. There's a lot of things working against our immune systems working correctly. And there's nutrient deficiencies, there's stress, there's toxins, a lot of different metals interfere in the immune system functioning in many different ways. Vaccines, 100% against, because vaccines improperly train the immune system. And I think vaccines are one of the reasons autoimmune disease are on the rise, because they screw up your immune system functioning on many different ways. And also, when people develop a sensitivity to mercury, which is in the thyroid gland, the body can be trying to attack the mercury, but in turn, they're actually attacking and destroying the thyroid tissue where the mercury is. And so that can be another reason people develop Hashimoto's or autoimmune thyroid disease. And so aside from that, I think it's really important for anyone with Hashimoto's. They need to detox just like everybody else. But there are some special considerations that people maybe want to be thinking about. Black Cumin Seed Oil is an amazing product to help with Hashimoto's. I really love Black Cumin Seed Oil. It's you can take it internally, so you can take about a teaspoon a day of this, and you can also take a little drop of it and you can put it right on your thyroid gland and rub it directly in your neck, and it absorbs and gets into your thyroid gland in that way as well. And there's a lot of black cumin seed oils on the market, but a lot of them have solvents in them. They're not very good products, or they've gone rancid because of the way that they were processed. And the Perfect Press products are just bar none. They're so pure. It's such an amazing, amazing supplement. There's no additives to this. There's no hexane. There's no solvents. And it's they have this proprietary press method of pressing the seeds. And this is just the best like the black cumin seed oil on the market. It's really fresh. And you can look at it, if you have black cumin seed oil at home, you can look at the color of this compared to the you may have at home. It's like night and day. It's totally different. And so I take this every single day. It's has so many different benefits, not just for Hashimoto's, but I think it's especially important for people that have Hashimoto's. I'm also a big fan of correcting immune system function with bioenergetics. Nest Health is a program that we offer. It's a bioenergetic program that we offer for people. And I haven't really seen anything like that program for improving immune system functioning, immune system malfunctioning, and autoimmune disease. It's just really the stories of healing of people with really severe and advanced autoimmune diseases completely reversing on that program. I've heard so many stories about that. So that's something I really recommend for people that have Hashimoto's to put it into remission. But you have to detox also. And so Hashimoto's can be kind of stealth because Hashimoto's doesn't always induce hypothyroidism, where it can be found with doctors doing blood tests for T4 and T3 and TSH. So you can get Hashimoto's apart from hypothyroidism or low thyroid function and still have a reasonable or normal production of thyroid hormones. And so you can have antibodies attacking your thyroid, yet have totally normal production of T4 and T3. And in time, 5 to 10 years down the road of thyroid tissue being destroyed, you're eventually going to have low thyroid hormone production. So it's really important when you go to your doctor to get a test for antibodies. You usually have to ask for this. You may have to demand it from your doctor. It's not enough just to check TSH, which many doctors do only. You have to demand, as the patient, be your own advocate and ask for a complete panel to get a complete picture of what's going on with your thyroid. And mercury will also induce autoimmune diseases, like I said, from people that are sensitive or develop a sensitivity or an allergy to mercury. So people, depending upon their genetics, can develop antibodies to different types of mercury. Some people can develop sensitivities to inorganic mercury from mercury fillings. Some develop sensitivities to the methyl mercury in fish. For others, they can be sensitive to thimerosal, which is 50% mercury found in some vaccines like the flu shot. And you can find antibodies to one or all of the above with a ELISA test. It's MELISA. It's a ELISA test, and it tests for sensitivities to metals. And most commonly, mercury can induce anti-thyroglobulin antibodies involved in Hashimoto's, but can also induce antibodies that cause Graves' disease, where your thyroid really speeds up, and you can have lots of anxiety and unpleasant symptoms from that. So I don't offer the ELISA test, but it can be a clue for some people as to why they're having health issues and thyroid issues. And I wanted to talk about the iodine debate in regards to Hashimoto's disease. So I personally don't believe, in the medical director of the Mai Detox program, the Mai Detox Protocol, Dr. Bruce Jones, don't believe that Hashimoto's can be improved or reversed without iodine, because the thyroid hormones are made of iodine. And so I think that people need to take at least 300 micrograms per day of iodine, even when they do have Hashimoto's. Everyone's going to be different. Some people don't tolerate iodine. So if you don't tolerate it, don't take it. But I think it's prudent for people to attempt to try iodine and see if it works for them, and very, very slowly titrating up, increasing the doses until they find that dose that's right for them, that gives them the iodine levels that they need without making them jittery or causing insomnia or revving up the thyroid too much. And so that's pretty much my presentation about how and why you want to be detoxing the thyroid and what kinds of things can interfere in thyroid function. And, I really appreciate all of you guys and sticking to your Mai Detox Protocol, and really encourage you guys to stay on it, stay on your protocols, because detoxification takes time. I've said this time and again. If you have spent, 30, 40, 50 years accumulating toxins, you're not going to reverse that in 6 months. It's just not physically possible. And detox is that's safe takes time. A safe detox is a slow detox, because you can only, depending on your health status, you can only handle so much release of toxins into your system to be processed and eliminated from your body in one day. And if you're very, very ill, you may not be able to tolerate detox at all. You may have to take some measures to improve your health before you can then get on a detox program or tolerate a detox program. And everyone's a little bit different. That's why it's good to work with a practitioner while you're doing a detox. It can be very complex. So do you guys have any questions? I'll be taking questions now for anyone that has any issues whatsoever and wants some support on their program, has any burning questions about how to detox or any of the detox protocols or any of their supplements. Please just leave a comment in the chat and I will answer any of your questions. Essentially, the Myers Detox Protocol is a program that I developed over working with thousands of people. And it's, a very comprehensive, holistic detox program where I start with a hair mineral analysis. And then sometimes I'll recommend someone does a urine metals test because we see different metals in the hair, some different metals in the urine and different metals in the stool. But I start with a hair mineral analysis to detect different types of minerals and metal toxicities that people may have. And then I develop a custom supplement program based on that hair test, based on the person's health history. And then they're given different supplements and detox protocols like infrared saunas and ionic foot baths and coffee enemas, and just given a certain diet to eat, and just given a lot of support on this type of program with email support and webinars to help them detox. And so if anyone's interested, and you click on the link below if you want to try a Myers Detox Protocol detox program, there'll be a link below in the show notes to try one. And since you guys don't have any questions, that's pretty much it. That's the presentation. That's a webinar. Thank you so much for joining me. So appreciate you guys hanging in there. We have another amazing webinar in a couple weeks about my new my new mitochondria detox. We have a new exciting development with that. So we'll have a webinar about 2 weeks on that. So stay tuned and glued to your email for that webinar. So I'll see you guys next month with a different topic. And thank you so much for joining me.